Hey guys! Welcome back to my channel! This is Little Pina Explorer, and yes guys, ako lang to. This is just my new hairstyle. That's what we do when we're bored, right? But anyway, today's video, I will be talking about the common medical terms that we normally use here in the UK, in the hospitals. And these are like words that I personally encountered during my 3 years of doing surgical nursing. I think this is important for you to know because in the Philippines, we are used to the American terminology. I'm also including some of the abbreviations that are commonly used, and this may or may not be formally approved by the hospital regulating bodies, but bottom line is it's actually used, so it's still important for me to discuss about it. So without further ado, let me start. The first one is observations or OBS. In the Philippines or America, they call it vital signs. Instead of saying we're gonna do endorsement, we say handovers, deranged. I don't know if a lot of people know about this, but me personally, I didn't know what deranged was, but it's actually abnormal. Fits is seizures, seizures. Yeah, seizures. And then bung is what we call heplock. Sick, it means nausea. So sometimes we ask, are you feeling sick? It means, are you feeling nauseous? Porter is like, I think we call it ISW in the Philippines. Those who run around, do some errands, or push beds. Next is datix. We call it incident report in other countries. NBM is nail by mouth, and that's just similar to NPO, which is nothing per RM. E plus D is eating and drinking. In the Philippines, we use DAT, which is diet as tolerated. A&E is emergency room. The ML, we call it meals. We don't say CC here. 10 mils, 5 mils. FBC is full blood count. In America, it's CBC, complete blood count. Theater, we call it operating room in the Philippines. Sometimes they would call stretcher as trolley. Main, it means tomorrow morning, /7 means days, /52 means weeks. So if they put 2/52, that means 2 weeks. 4/7 means 4 days. Ward managers are called sister, and the matron is like the manager of your manager. Supernumerary, usually when you're just starting, in the first few days, you'll be supernumerary, and that means you're not part of the staffing at that time. You're just shadowing, observing people, trying to adapt and trying to learn as well. ROS or ROC, removal of sutures or removal of clips. And then BM, we know it as bowel movement. It's basically blood sugar monitoring. IDC is indwelling catheter. BNO is bowels not opened, or BO is bowels opened. TTO or TTA, to take out or to take away. And these are just medications that the patients need to go home with. PU is pass urine, and OTT is out to toilet. Sometimes you will see it in the fluid balance chart. FWB, NWB, or PWB, that means full weight bearing, no weight bearing, and partial weight bearing, especially for orthopedic patients. So full weight bearing is there's no restrictions, they can put weight on it. Partial weight bearing is just like maybe 20%, depends. And no weight bearing is like they can't really put weight on that foot. ABX is antibiotics, and R/B is review. PTOT is physiotherapist and occupational therapist. NKDA is no known allergies. POD is post-op day. So sometimes they will put POD1 or POD2. That just means post-op day 1 or post-op day 2. ZF is Zimmer frame. TF is transfer. WR is ward rounds. D or C is discharge. F/U. This is not a curse word. This is actually follow-up. VTE is venous thromboembolism. AO1 or AO2, it's assistance of 1 or assistance of 2. PN is practice nurse or parenteral nutrition. MCNS is microscopy, culture and sensitivity. IDT, infectious disease team. TVN is tissue viability nurse. LMWH is low molecular weight heparin. It's just the injection that we use to prevent blood clot clots, and that includes enoxaparin or dalteparin. I just want to add as well, they pronounce it differently here for cefuroxime and ceftriaxone. So instead of saying cef, they call it ceftriaxone or cefuroxime, or something, cefuroxime. I'm not too sure na. Okay, so I think that's my list as of the moment. And I remember the time that I was starting, I felt so stupid because I didn't know a lot of words. I'm just glad that I have this platform to share to people what they should expect and what they can learn from, so that it will be a bit lesser of this kind of feeling na you feel so stupid. And I'm sorry that people are like experiencing these things. But guys, don't worry, because it's just part of growing up. You'll get there and you'll get used to it. So I think, guys, that's it. That is my vlog today. I hope you learned a lot from this video, and I hope you're not bothered with my bangs, because I'm so bothered with my fringe. This is actually called fringe here in the UK. I am planning to upload more videos, so subscribe to my channel, and I will see you on my next vlog. Bang, 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 bang. 오빠 사랑해.